USMLE-style question. A 67-year-old man with a history of long-standing hypertension and diabetes is brought to the emergency department after suddenly losing consciousness. His wife states that he had been complaining of a severe headache and right-sided weakness before collapsing. On examination, the patient is unresponsive with a leftward gaze preference, right-sided hemiplegia, and hemisensory loss. A non-contrast CT scan of the head shows a hyperdense lesion in the left basal ganglia with surrounding edema and midline shift. Which of the following is the most likely cause of this patient's condition? A. Hypertensive vasculopathy. B. Ruptured saccular aneurysm. C. Cerebral amyloid angiopathy. D. Arteriovenous malformation. E. Reperfusion injury after ischemic stroke. Answer and explanation. Correct answer, A. Hypertensive vasculopathy. This patient has a hypertensive intracerebral hemorrhage, ICH, which typically affects the deep brain structures due to long-standing hypertension. Chronic hypertension leads to Charcot-Bouchard microaneurysm rupture in small penetrating arteries. Most common locations: 1. Basal ganglia, putamen, most common. 2. Thalamus. 3. Pons. 4. Cerebellum. Symptoms depend on location: putamen, basal ganglia, hemorrhage, contralateral hemiparesis, hemisensory loss, gaze deviation toward the lesion due to involvement of the internal capsule. Thalamic hemorrhage, contralateral sensory loss, upgaze palsy, coma, pinpoint pupils, quadriplegia. Cerebellar hemorrhage, ataxia, nystagmus, dizziness, vomiting. Diagnosis: CT scan, hyperdense, bright lesion in deep structures with surrounding edema and mass effect. Incorrect answers. B. Ruptured saccular aneurysm causes subarachnoid hemorrhage, which presents with a sudden thunderclap headache and blood in basal cisterns. C. Cerebral amyloid angiopathy causes lobar cortical hemorrhages in elderly patients, usually affecting the occipital or parietal lobes. D. Arteriovenous malformation can cause ICH in young patients with recurrent headaches or seizures, but is less common in hypertensive individuals. E. Reperfusion injury after ischemic stroke causes hemorrhagic transformation after thrombolysis or spontaneous reperfusion, but usually appears as smaller petechial hemorrhages rather than a large hematoma. Key learning points: hypertensive intracerebral hemorrhage, ICH, most common cause, chronic hypertension, Charcot-Bouchard microaneurysm rupture, most affected sites, putamen, most common, thalamus, pons, cerebellum. Symptoms: sudden focal deficits, headache, vomiting, altered consciousness. CT scan, hyperdense, bright lesion in deep brain structures with edema. Complications: midline shift, herniation, death. Would you like a question on another type of hemorrhagic stroke, such as cerebral amyloid angiopathy or AV malformation?